A happy Wednesday morning, everyone, and a warm welcome to today's webinar on the eve of World Diabetes Day, which is observed every year on November 14th. The topic of today's discussion is diabetes management, and it is brought to you by the Kauvery hospitals in collaboration with the Hindu. Many of us already know what diabetes is. It is a condition when the body does not make enough insulin or it is not able to use up the insulin. And when this happens, there is too much glucose in the bloodstream, and over a period of time, it can cause multiple health problems affecting the kidney, the heart, or our vision. So it is very important to keep reiterating some important messages, like how we should keep ourselves safe from diabetes, how the disease can be managed, what are the myths and facts surrounding the condition. To discuss all this today, and more, we have a very interesting panel of doctors from Kauvery hospitals in 3 different cities of Tamil Nadu. They will give brief presentations on the relevant topics associated with diabetes, and we request our audience to put out their questions in the chat box as they speak. So let me first get on with the introductions. We will first have Dr. P. Gauri, Senior Consultant Diabetologist from Trichy, speak on diabetic foot attack. Dr. Gauri has an extensive experience in the management of diabetes. After completing her MBBS from Coimbatore Medical College, she followed it up with post-graduation and specialized training in diabetology, cardiology, and echocardiography. Her academic qualifications also include an MSc in psychology, which she says have helped her to develop a holistic approach to patient care. For the past 16 years, she's been associated with Kauvery Hospital, where she provides comprehensive diabetes management with focus on innovative therapies and patient education. So it's over to you for the presentation, ma'am. Welcome.
Thank you, ma'am. Thank you for a nice introduction. Thank you very much. And good afternoon, dear 147 and odd people who are Hindu readers, and happy to meet you all on the eve of World Diabetes Day. So for the next 10 to 15 minutes, let me just have a brief discussion with you regarding diabetic foot problems. Shall I share my PPT?
Yeah, sure.
In the current scenario, I think most of the public are well aware of heart attack or kidney disease. So these are all having lot of awareness things in the public. But regarding the foot problems, I think there should be some more awareness among them to prevent a very messy and really costly affair. To reduce the burden of these things in their life, they should know something about diabetic foot problems. So diabetic foot attack is not like a heart attack which happens suddenly on one day. The patient is rushed up to the hospital, some angiogram, some procedure is all done, or a kidney problem or an eye problem, which all occurs on one sudden day. But this diabetic foot problem, I would say it is a chronic thing, which usually people, they don't notice in the early stage, and unfortunately they land up in a bigger problem later days which cannot be corrected at that point of time. So it is always important they know about this diabetic foot problem and they can prevent from going into a serious problem. So the main causes of a foot problem in a diabetic patient is due to some sort of infections occurring in the toes, in the interdigital space, or somewhere in the foot. And the other cause may be a nerve damage. This nerve damage usually doesn't occur on day 1 or day 2 of diabetes. When people are living with diabetes for more than 5 years or 10 years, slow and slow the nerves get damaged, which gets unnoticed by some time, and then later on they end up in a problem. And the other one is reduced blood supply. The blood don't flow into the toes. And last but not least is the high sugar level, which they don't maintain in their routine care. So these are all the main causes for any patient, for any person with diabetes to get into a foot problem. So if they are able to find out these problems in an earlier stage, we can prevent those people from going on to a serious diabetic foot wound or ulcer, which may land up in a serious problem, resulting in a loss of limb. It is said that when a patient develops an ulcer, the chance of losing a limb is almost 25%. That means for every 100 people who have a major an ulcer, they will land up, 25 people of them will land up losing a limb, which can be either a toe or a below knee or an above knee. Sometimes they may even lose their life also. So what important is it, message it gives us is, rather than getting an ulcer and then suffering into all these problems, it is always better we identify those problems in this stage and treat accordingly, and uh, I mean, save us from all those problems. Now, what are the predisposing factors to prevent all those things? The main predisposing factors which we have to be vigilant in our day to day life is, look into the callosities. Callosities are nothing but thickened areas of skin which can be present on pressure areas. When we walk with a barefoot, we give pressure to almost all the parts of the foot, but some places they bear the major pressure. Those areas, the skin gets hardened, and what we call as callosities or calluses develop. We also call it as corns. So always we have to be vigilant in looking into whether we have calluses or not. And the second thing is, these are all small blisters that occur on the heel or on the lateral aspect of the ankle. Blisters are nothing but some small fluid filled vesicles. If we don't take care of them properly, they may get infected and then they may land up in problems. So first one, what I said was callosity. Second one is blisters. And this is the common entity which is seen in many of our patients. Ingrown toenail, இது வந்து most of the obese people, most of older people, and most of the people who do not wear a proper footwear, நல்லா அப்படியே கம்ட்டா இருக்கும் அவங்களோட செப்பல்ஸ் எல்லாம். What happens is, due to chronic chronic weight bearing and prolonged walking, standing people, and the nails, they just grow inwards and they slowly get infected. So this does not happen all of a sudden. This will be there for months and years, and one fine day they will find some pus coming out, and the pus gradually ascends up, landing up in a little serious problem. And the other one which I want to highlight is warts. This usually occurs for people who walk barefoot. These are all viral infections. This can be a viral wart, where small viral particles, they join to form a wart, a thickened thing. Patients will have a minor pain. So there can be calluses and that can be warts. These are all the predisposing factors. And one other thing is some infection between the toes. This usually is seen in people who work in water, washermans are to do, especially ladies who work a lot in water. அவங்களுக்கெல்லாம் வந்து they don't dry up the area between the toes. So that gets infected often. Excuse me. So these are all the 5 predisposing factors which we have to take care of to prevent serious ulcers happening in the future. Right. This is another thing, little serious thing, but you have to be aware of this thing also. All the toes and all the parts of the foot, they have to be in a proper, shape. If they are not in a proper shape, we call them as deformities. The deformities can be in the toes, it can be in the ankle, it can be in the sole, anywhere. These deformities, what they do is they alter the pressure when we walk on the foot. So wherever there is deformity, there is high pressure and people start getting problems in that area. So beware of all these predisposing factors, callosities, uh, intertrigo, warts, deformities, etc., and try to approach your doctor and ask advice from them what to do next to prevent ulcers. So how can we prevent? Main thing is three main things. When you want to prevent ulcer in your foot, you have to take care of these three things. One is quit smoking. Smoking is the most important factor for any patient's foot ulcer going into non-healing and later on resulting in lot of problems. Yeah. Second one is walking barefoot. In our culture, Indian culture, especially Tamil Nadu culture, we often walk barefoot. We are a little reluctant in using footwear inside the house. We are very much reluctant in using footwear inside the temples. For that, we have temple socks also available. So never walk barefoot unless it is very much essential. In that places also, you can go with temple socks or some other preventive food items which you can discuss with your doctors and identify. So don't walk barefoot. And apart from that, the underlying point is control your sugars, control your BP. I missed up one thing, control your cholesterol. Sugar, BP, and cholesterol, they clog your blood vessels, they cause obstruction of your blood vessels, they damage your nerves, they cause infections, and they also can cause insensate feet. So, all the issues which form the risk factors for foot ulcer can be controlled by just looking into these three things. Among these three things, I would say stop smoking is the main thing which you have to address. So those people who are currently smoking, it is my personal request on this World Diabetes Day Eve talk, please try to stop smoking right from today. Yeah. So what I told earlier was foot ulcer is going to be a bigger problem. If you want to prevent foot ulcer, you have to look into certain predisposing factors, which is easy. You just have to inspect all those things. So how are you going to inspect these things? A doctor is not needed for that. You yourself can do this. It will take just 3 minutes. Daily, you have to spend 3 minutes. Either you can do it getting up from bed in the morning or before retiring to bed, night, padukkarak munnadi, you just spend 3 minutes. See your foot, inspect your foot, palpate your foot, and find if you have those five problems. So in the 3 minutes, what all you can do, and I'll just enumerate. Yeah, first thing, examine between your toes. This usually we forget because நம்ம மேலோட்டமா பார்க்கும்போது foot is fine, right? Okay. But in between toes, you may have some whitish things. You may have some ant bite marks. See, people with sugar, when their sugars are not under control, that the odor of the sugar will invite ants. So lot of people they come unknowingly, madam, I don't know. There is something in between my toes. They are all ant bites. So always examine between toes, first thing. Second thing is examine your nails. This is an yellowish discoloration of your nail. There can be thickening of your nail. There can be brokening. We call it as brittle nails. So always examine your nails and try to cut your nails straight across. It should not be like a crescent. The thing is, if the nail goes deep into the side part of your nail, it can start brewing some infection, and that is the starting part for toenail infection. So whenever you cut your nails, it should be straight across, and please don't cut the nails with blades. You cut it with a nail cutter where you can give a gauge and give appropriate pressure accordingly. After you cut your nails, you can just smoothen the edges, because when you sleep at night, when you scratch with one toe, it can cause injury to the other leg also. So second thing is examine nails. Third thing is examine the skin, not only of foot but also the legs. Naraya, when you're a diabetic for more than 10 years, we say diabetic can affect your kidney, your heart, your eyes, but most importantly, it can affect your skins also. That is called diabetic dermopathy. What happens is small infection, small either fungus or bacterial infections, or small vasculitis problems all can occur, and these may be the starting point of infection. So examine your skin and then examine your heels and sole part. The heel should be an important part of your feet because there are a lot of pressure issues in the heel. You get fissures, you get callosities, you get pain also in the heel. So all the four things what I enumerated. So you have to examine your toes, in between your toes. You have to examine your nails. You have to examine your skin, and of course your sole and the heels. இதை examine பண்றதுக்கு hardly you require just 3 minutes. You take time before you go to bed, just watch it, and if you have any cuts, if you have any bruises, that means some reddish color வருது, ஒரு கட்டா இருக்கு, இல்ல you have some whitish discharge coming out, some problem you are able to find out அப்படின்னா immediately you go to your doctor and try to find out what is the reason behind it. If you leave it for a week or 2 weeks, later on it will be late, and the infection would have ascended up further higher level, so that some sort of surgery would be needed at that point of time. So this is the 3-minute examination which you need to have daily in your lifetime. And I've just put 2 slides on foot care. See, foot care, for that you don't require a doctor. You have to take care of your foot. Like you wash your face daily, you please wash your foot also daily. முகத்துக்கு கொடுக்குற அக்கறையில அட்லீஸ்ட் பாதியாவது நம்மளோட கால்களுக்கு கொடுத்துக்கிட்டே இருந்தோம்னா கட்டாயமா நம்ம ஃபுட் ப்ராப்ளம்ஸ் இல்லாம தடுத்துக்கலாம். The first thing what we usually do is சிட்டிங் கிராஸ் லெக். இது நிறைய பெரியவங்க செய்வாங்க, கீழே காழ போடாம. இப்படி பண்ணும்போது the blood supply for your foot comes from your hip. அங்கிருந்து வரக்கூடிய arteries, nerves, everything will get pressed when you sit cross-legged for a long time. So always avoid sitting cross-legged for a long time. And also sitting in the same posture for a long time. ஒரு 15 to 20 minutes ஒரு தடவை just walk, then ஒரு 5 minutes போயிட்டு வாங்க. That will be a good option. And a big no for applying heating pads, applying hot water bottles. And there is a fancy of nowadays people soaking their feet in a bucket of water. Madam, I just put, and I put some salts also in that. அது போட்ட மஞ்சள் போட்ட அப்படி போட்ட எப்படி போட்டேம்பாங்க. சரி, எப்படி போட்டாலும் please don't soak it for a longer time. When you soak it for a longer time, your skin goes dry. Actually, you wet it for a longer time, but once you take it out, and then and the moisture, skin order, natural moisture will go away and the skin becomes dry. So a big no for all these things, especially for those people who, when I say there is already nerve damage, neuropathy irukku, or some sort of blood supply problem irukku அப்படின்னா, please don't try all these things. These can land up in really dangerous issues later. And other few do's and don'ts in your foot care is this already look into your intertrigos, and whenever you get a small cut or a small ulcer, when you go see a doctor, they will give a bandage. This is to protect your ulcer from further supernodal infection. But people usually bandage pota adu punnu aaradu. There are some myths. Kattu pota punnu aaradu அப்படினு. It is not like so. This bandage will be a protective layer which will prevent from future, further secondary infection also. So unless the doctor says don't put a bandage, it is always good you put a bandage on it. And cut your nails straight across, and always cut the nails after taking a bath. Because when you have diabetes for a long time, your nails, they get a tendency to become thicker. When you compare it with a non-diabetic person, your nails be thicker, so it is difficult to cut it in a dry state. So cut it after taking bath. That will be easy for you to cut your nails. And wearing socks is a good habit, but in our culture, veshti poturkom, we don't have the habit of wearing a socks. It is okay as far as you keep your feet dry and clean, but wearing socks is a good option. And always, as I said, the 3-minute examination for people who are not able to bend and see, knees la problem irukku அப்படிங்கும்போது, there is a hand mirror. நீங்க அழகா வச்சு பார்த்துக்கலாம். And if your son or if your daughter are able to, or they're happy to help you அப்படின்னா, every day they can see your feet and give you some advice on it. And this is a good handy thing, a footwear, a hand mirror, which will give a detailed picture of your foot. And last but not least, wearing a good footwear. This will be like a சூரிய கவசம் for கர்ணனுக்கு எப்படி கவசம் இருந்ததோ அது மாதிரி உங்களோட ஃபுட்டுக்கு வந்து இந்த ஃபுட்வேர் will be like a கவசம். So always நீங்க தீபாவளிக்கு ட்ரெஸ் வாங்குறீங்களோ இல்லையோ, வருஷம் செப்பல் வாங்குங்க. How that செப்பல் should be? This is called a footwear, a special diabetic footwear. Let me just tell you few points how a diabetic footwear should be. A diabetic footwear எப்படி இருக்கணும் அப்படின்னா, it should not be pointed, it should be broad. All your toes inside should be freely moving around. ரொம்ப crooked ஒரு footwear வாங்குறீங்க, fancy footwears எல்லாம் பார்த்தீங்கன்னா, it will be so crooked and all the toenails எல்லாமே உள்ளுக்குள்ள crowded இருக்கும். That results in all problems in between the toes. So your footwear should have a broad, this is called toe box. The area of the footwear which contains the toes is called as toe box. The toe box வந்து நல்லா broad இருக்கணும். Second thing is, if it is an adjustable velcro, it is easy because diabetic people, when they sit for a long time and the neuropathy எல்லாம் வரும்போது, your feet tend to swell in the evening. they லைட்டா நீர் கோர்த்த மாதிரி இருக்கும். இப்போ அந்த சமயத்துல ஒரே permanent footwear போடும்போது உங்களுக்கு வந்து டைட் ஆயிடும். If it is an adjustable footwear, as per your foot size, you can adjust the size also. It can be laces, it can be buckles, it can be a velcro also. So broad rounded toe box, adjustable things, and if the material is a leather or canvas, it is easy, breathable, நல்ல ஒரு aeration இருக்கும். Leather and canvas is a good material for your footwear rather than a plastic. Plastic வந்து ரொம்ப moisture இருக்கும், அதுக்குள்ள ரொம்ப வழுக்கிட்டே போயிட்டு இருக்கும், heat கொடுக்கும், it is not breathable, it is not durable also. So if you want to choose a footwear, go for these two materials. It will be and other one is microcellular rubber and microcellular polymer. They'll be little costly. I think leather and canvas should hold good for everyone. And the footwear should not be too small. எனக்கு வந்து டிசைன் பிடிச்சிருக்கு பட் சைஸ் கரெக்டா இல்லை, பட் ஈவன் தென் ஐ வில் அட்ஜஸ்ட் ஃபார் த டிசைன் அப்படின்னு ப்ளீஸ் டோன்ட் கோ. யூ ப்ளீஸ் அட்ஜஸ்ட் ஃபார் த சைஸ். You don't adjust for the design. Don't go for the design, you go for the comfort. There should be at least half an inch between the longest toe. That will be a great toe, of course. There should be at least half an inch between the greatest toe and the end of the shoe. And the shoe border ku ungaloda toes ku ஒரு half inch அது gap வெச்சுக்கோங்க. அப்பதான் டக்குன்னு எங்கயா தெரியாம போய் இடிக்கும் போது the toes will not be hurt. You will be hitting only the footwear. That will be an added protection to your foot. Please avoid high heels and slip-ons, which they cause undue pressure in your foot and they result in all those callosities, deformities, which I told you earlier. So avoid high heels and avoid slip-ons. And one other thing which I want to tell you about the footwear is, some people when they grow old, this doesn't usually occur in younger individuals, but 70 plus எல்லாம் பாத்தீங்கன்னா அந்த toes எல்லாம் கொஞ்சம் shape மாறும், கொஞ்சம் கால் இந்த விரல் கொஞ்சம் மேல போயிடும். This is called claw toes. So when you get a footwear which is like this, your toe will be rubbing against it and you will get an ulcer here. So your toe should be wide enough, deep enough and long enough. அது அந்த மூணு மட்டும் பார்த்துக்கோங்க. நல்ல நீளமா இருக்கணும், தேவையான அளவு வைடா இருக்கணும், and in order to adjust your deformities, it should be this usually for the shoes. நம்ம வந்து செப்பல் போடும்போது இந்த டெப்த் கான்செப்ட் வந்து அவ்வளவு தேவை இருக்காது. So I think in the past 5 to 10 minutes, I would have given a brief note about foot ulcers, because when you don't take off whatever I said earlier, if you don't take care of that properly, you land up with this big ulcer. This is really going to be a nightmare, not only for you, for also the treating doctor, because it will require a plastic surgeon, a diabetologist, a vascular surgeon. இதுக்குள்ள நிறைய பேர் எஃபர்ட் போட்டு இந்த அல்சர் மூட வைக்கிறதுக்கு everybody has to put lot of effort. Why to go to this problem? You have to prevent from going into this problem. So my World Diabetes Day message will be that always prevention is better than cure, not only for this foot, for all the organs in your body. So வருமுன் காப்போம் சொல்லிட்டு, thank you for the opportunity given. நன்றி.
Thank you, Dr. Gauri, for that very intensive and informative session. We will now move on to our next speaker, Dr. K. Bharanidharan, a senior consultant diabetologist from Chennai, who has done his MD in general medicine, and he will now talk on the recent advancement in diabetes medication and technology. Welcome, and over to you, Doctor.
Thank you. I'll share my slides.
Yes.
So, Vanakkam. Happy to welcome you all to this diabetes wellness series. Today, I'm going to talk about advancements in diabetes management. I'll just make it short and sweet. So, I'm just going to discuss. As such, we heard a very good talk from Dr. Gauri about food care. So, விஷயம் சொல்லணும்னா டயபெட்டிஸ் அகத்தின் அழகு முகத்தில் தெரியும் டயபெட்டிஸோட அழகு நம்ம கால் பாதங்கள் தெரியும் அது ரொம்ப அழகா ஷேர் ஜஸ்ட் given the elegant talk. Now I'm going to discuss about the advancements in diabetes. This is the agenda. I'll make it short and crisp. What is the current burden of diabetes in India? And even I'm just going to discuss about the new advancements in medications and what is the digital diabetes interventions today, what we are doing, and how will be the future of diabetes care. So this is the agenda. Previously, 20 years before, actually the communicable disease is threatening globally, like tuberculosis, HIV. We are not hearing that much. Now we are hearing what is called a non-communicable disease, especially the diabetes, hypertension, cancer, obesity, all those things we are just hearing nowadays. And it is a ticking time bomb of the current century. And we know the tsunami, we are thinking diabetes as a health tsunami of this century. And currently, the ICMR, the Indian Council of Medical Research, projected almost 101 million people are suffering from diabetes in India, and almost 130 million people are pre-diabetes. That is, any point of time they may be converted into diabetes. So when you see people, 1 in 11 people are diabetes currently, and the number is going to increase. So it is going to be big challenges like economic burden for our country. So this is the current scenario of diabetes in India. As such, we are thinking India as a diabetes capital, but as a physicians, how we are going to make India a diabetes care capital of India, and what are the advancements are happening in day to day today. So there are a lot of newer medications, even though the burden of diabetes is increasing globally. So in India, especially, there are new medication has come which change the way we practice today. So it has changed the practice. Now the future of diabetes care. So everybody is fear about the insulin. So there is a new insulin is going to come to the market very shortly. What is called the icodec. So this is a basal insulin. It will be the game changer for diabetes. What is unique in this insulin is actually insulin. When you suggest they have to take every day, and every time every day they have to take the insulin. But this insulin is going to be once weekly insulin. That is, people who need insulin, they can take these injections once a week, and it is going to be a long-acting insulin, which is going to help the diabetes patients, both type 1 and type 2 diabetes. And there are a lot of studies, and it is going to hit the market very soon. So what is unique? Actually, when you suggest insulin, they have to take every day. It comes almost 365 injections almost for a year. But this will reduce the burden of injecting almost to 52 injections per year. That is weekly once. So 52 weeks they can just take. So we'll wait and see how this injection is going to change the diabetes management. And if it comes, definitely it will give a ray of hope for diabetes patients who are all taking more insulin every day. And currently, this drug, which is available in the market, what is called the sodium glucose transport inhibitors, SGLT2, this is available in India. And actually, I just want to say this molecule is a miracle molecule. So because even though the diabetes burden is increasing, the management of diabetes is totally changed. This drug, how it changed? Actually, this drug is mainly discovered for diabetes management, but they just underwent a trial. So and prove that this should be drug for safe to just to see whether it is safe for the heart. But actually, this drug has proven that it is very good for the heart and also for kidney. So this drug, the sodium glucose transporters inhibitors, which given to the diabetes patients, improve the heart functions. It just improve the rate of heart failure, preventing the heart failure as administration in the hospital. And also, whenever we have diabetes, the problem is in the kidney, where just throwing more proteins in the urine, the kidney problem. So this also reduced with this molecule. Actually, when you start this molecule in early onset of diabetes, so overall the risk factors for getting heart and kidney problem, definitely this is going to be the boom for diabetes patients. So actually, when we treat diabetes, we are not treating just the number like bringing the fasting sugar, the postprandial sugar, or the HbA1c. Our aim of treatment of diabetes is main to prevent the complications. All diabetes management, as Dr. Gauri also said, that food problem, it's all happens only when we don't. So when you take care of diabetes, so think about the complications. So preventing the complications even at the earlier onset of diabetes is very important. So this drug is really a good for not alone controlling the diabetes, It also preventing the heart problem and the kidney problem in the future, and it has a lot of pleiotropic benefit. There is a somewhat of weight loss is also there, and blood pressure reduction is there with this molecule. So this molecule is a really boon for a patient suffering from diabetes, which initiated, and also more than that, this improved the quality of the life of the patients. So we are just seeing in everyday life. And another drug called GLP-1 analog, which is also available in our country. So GLP-1 drug is called the glucagon-like peptide. So it is actually secreted in the body itself, and this drug is especially used in treating not only diabetes but also for obesity also, because obesity is a major problem not only in India but globally. So obesity is the main reasons for getting diabetes and other complications like hypertension and also knee osteoarthritis. Everything is related to the obesity. So this drug actually, just like a normal GLP, that is which is secreted in the body, we are giving it externally with this analog, and this drug actually reduces not only the sugar, it also reduces the weight, and also it improves the quality of the life. So currently there are molecules available in tablet form as well as injection forms. These are all the molecules where in India we have a Ribelsis, that's a semaglutide oral tablet is available. It should be taken every day. And the Ozempic, which is an injection form, it can be taken weekly once. And also there are a lot of other drugs like Trulicity, Wegovy, Mounjaro. All of you can just hear about in the paper also when you are just heard about these drugs. This is some of the drugs which is not available in India, but very soon it can be available in India. And we just looked into the medication part. I will just go into the digital diabetes intervention. What is digital diabetes interventions? See, after COVID, even I'm just discussing through webinar. We are not connected physically, but we are connected virtually. So the same way, the treatment of diabetes is going to be a digital things. So because the burden is more, so everybody needs interventions immediately. So they can connect to the physicians immediately, and the future of diabetes care will be a digital diabetes interventions. And currently, what we are using is, I'm just going to talk about the real-time continuous glucose monitoring study. What is this continuous glucose monitoring study? It's a very simple. Actually, when you just want to check the blood sugar level, we always use a glucometer. So glucometer is one thing which, whenever we need to check the sugar level, we just check the blood sugar level. We check the fasting, we check the random blood sugar like that. But the meaning of continuous glucose monitoring study is just to check the blood sugar level continuously, and it will monitor the sugar level every 5 minutes once. It is a small, tiny sensor like 1 rupee coin, which is fixed in our on the skin, and it just reads the blood sugar level from the interstitial fluid. And within every 5 minutes once, we can able to track the blood sugar level via Bluetooth technology through your mobile or even a monitor. This is called the continuous glucose monitoring. The left side, what we are seeing is a continuous glucose monitoring study. The small sensor fixed in the arm, and it can be just the blood sugar readings can be viewed through the mobile devices itself. On the right side, what the conventional blood glucose monitoring, the glucometer, what we are seeing. So this is what the change in the practice today. And here it can be used through a reader with a sensor, or nowadays we have a real-time monitor with the mobile devices. We can able to monitor the sugar level. So there are a lot of informations we can just able to get from the blood sugar level. So what we can see is the trend, how the 24 hours blood sugar levels is going on, and where the fluctuations are happening, whether the sugar level is going down at some particular point of time. After eating, we maybe think about the diet. So whatever the diet we are taking, how it just alter the sugar level, and how your medications alter the blood sugar level. All the trend we can just able to monitor in this continuous glucose monitoring study. And more than that, actually, the real-time glucose monitoring is, so a physician can monitor the blood sugar level in a remote place. So with the monitor, actually, a patient sitting in the home, they monitor the blood sugar level in the mobile. Immediately, the data is transferred to the physician, and he can just look into the data in his office itself, and he can just through his diabetes care team advise the medications or adjust the diet. So whatever the inputs the patients are giving, like the diet and the medications, the physical activity, accordingly they monitor the blood sugar level and the diabetes care team, and they advise them, and they can give what we call as a precision diabetes care, which is really possible nowadays. And now we get a very good graph, like a time in range chart, which gives a decision making. So in this chart, actually we are seeing one real-time patients where we are seeing the time in range. That is, people who maintain blood sugar level between 70 to 180. So that is the target range we need, and we can able to see how much of time the blood sugar level is high, like between 180 to 200, and how much of time the blood sugar level is like more than 250, the very high. And also we can identify where the blood sugar level is going low, less than 70. So here the green, the target range 70 to 180, almost only 39% of them only they kept the blood sugar level, and most of the time 34% the patients are in a high sugar level. So this gives a decision making for the physician to adjust the medications and also identify the diet and the physical activity, and everything is combined together. Then they can improve the time in range. That is the target range to 70 to 180 to more than that. At least actually the consensus statement globally that if they maintain almost more than 16 and a half hours, that between 70 to 180 milligrams of blood sugar level, that is very good for them to prevent any complications in the future. So this continuous glucose monitoring study is really a boon for a diabetes management, especially for both the physician and the patient also. So in the patient's perspective, they understand that how the medication works, and the fear of hypoglycemia, the low sugar is also reduced, and also they can able to see that the medications and then the diet and the physical activity helps in how much of diabetes control. For the physicians, actually for them, the main thing is if they initiate medications, the problem of low sugars or how the fluctuations, how the medication works, so they can give the precision diabetes care. So the continuous glucose monitoring study, it's really changed the way we practice today, and this is available currently. And I'm going to talk about how the future of diabetes care will be. So as such, the digital transformation is happening. The future of diabetes care, every time we are just hearing about the artificial intelligence and then the machine learning, especially in a diabetes care management, it's going to change. So it gives a tailored dosage. You talk about diabetes, a single patient is not the same everybody, because if diabetes globally the burden is high, each individual is different. We can't just give single medications for everyone. So each individual is different. Each individual's beta cell pancreas function is different. So everyone actually needs a different type of management. It is like wearing a shirt. So it's a tailored dosage for each individual. So the diabetes management is a holistic, individualistic, and we have to look into everything. So everything is now smart. So like we have to have a specific goal. It should be measurable, and it should be achievable, and it should be realistic, and it should be time bound for an individual. So the artificial intelligence and machine learning is going to take care of this in the future. So whatever the inputs we are just going to give regarding a diabetes patients, and it will just give the algorithm, and also it can be very much useful for diabetes patients to have a disciplined lifestyle with the medications and then the physical activity. They can able to improve the lifespan, and the quality of life is going to improve. So other thing, the future is the gut microbiome. So what is gut microbiome? Because now what happens, actually we have a lot of bacteria in the body. So the gut microbiome is one of the very important future of diabetes management and other lifestyle disorders. It is now actually our microbiome, our good bacteria is completely changing today because of a lot of things, inputs we are giving. One is the pollution, another is the diet. So the diet, what we are eating, more of processed food and high calorie diet, which alters our microbiome, which is doing a lot of miracles in our body, because only the bacteria, good bacteria, is able to digest the fiber, and it can just release the short chain fatty acids, which is going to improve the gut health, and also the what we call as a dysbiosis. That means the alter in the gut bacteria is going to cause what is called the fatty liver, what we hear non-alcoholic fatty liver disease, which is a very common problem we are seeing now. All this or the change in the gut microbiota. So one gut microbiota is also the talk of future diabetes care, which is going to see in our next future things. So with that, I just give all this future of the advancements in diabetes management. I just end my talk, and we can have a healthy discussions. Thank you so much.
Thank you, Dr. Parinitharan, for those valuable inputs. We will now move on to our third panelist, Dr. R. Shanmugasundaram. He is the senior consultant from Salem who brings with him 18 years of experience. Having done his MBBS from Madras Medical College and MD in General Medicine from Coimbatore Medical College, he worked at the PhD Institute of Medical Sciences and Research as assistant professor for 2 years and worked at multiple other places before joining Kauvery. He has published numerous research papers and actively participated in various conferences and workshops on diabetes. So over to you, Dr. Shanmugasundaram, for your talk on myths and facts about diabetes.
Thanks for your kind introduction. After two informative talks, one about diabetic foot attack and recent advances, I am going to talk about common myths and what are the facts about that myths. Sure. On this World Diabetes Day, lot of misunderstanding is there, so I have to clear that because the treatment of diabetes depends on the patient's knowledge and patient's cooperation. So it is very important. So I will clear some of the common misunderstanding we come across in our practice. Next. So common myth is type 2 diabetes only affects adults. Now the screening recommended for people above 35 years if they are asymptomatic, but not necessarily if they have a family history or other risk factor, the screening to be done earlier. As Dr. Bharanidharan said, more than 10 crore people are diabetic, 13 crore people are pre-diabetic, and even before pre-diabetic, people are having many changes inside, like children are having that black skin in the neck and armpit. So screening should start earlier. It is easily available. So even children comes with a lot of diabetes nowadays. So better screening to be started earlier. So diabetes is increasingly diagnosed in younger adults, teens, and even in children, often due to rising obesity rates and lifestyle factors. Next myth. I feel fine. Only my sugars are in diabetic range. I don't think I need tablets. This one of the common answer when we say the first time blood report about high sugars than the normal level. The fact is, diabetes, like a high blood pressure, can have no symptoms at all. Only at very high levels, some people develop symptoms like polyphagia, polyuria, polydipsia. That is excess urination, excess thirst and drinking, and excess food intake. The damage caused by high blood sugars happens slowly over time. So do not deny treatment by saying that I am not having symptoms. It is highly variable. So if sugars are not under target on more than one occasion, that too with HbA1c more than 6.5, please accept your diabetes and follow as per doctor's advice. Next myth. I have taken many sweets recently. That's why sugars are high. It's not diabetes. I will correct it. Particularly recently, Diwali is over. When they come with the blood reports and we say that your sugars are not in the normal range, immediately they know, no, doctor, I had a sweet, so that is why. The fact is, type 2 diabetes is caused by a combination of genetic and lifestyle factors, not by eating sugar alone. If you don't have predilection for diabetes, eating sugar will not raise your blood sugars. So if sugars are high, and if it is confirmed with HbA1c, just don't blame the sugar, sweets alone, accept your diabetes and move on. However, excessive sugar intake can lead to weight gain. I'm not saying sweets can be taken, so it can lead to weight gain in the long run. It may cause, so which increases the risk of developing type 2 diabetes. So avoid or take sweets in moderation. Next myth. If I exercise and eat right, I shouldn't have to take medicine. Fact, most people with diabetes require medicine to keep blood sugars at goal. So first try with exercise and diets. If not controlled, please accept the medications and continue exercise and proper dieting. So if sugars are not under control despite exercise and diet, please accept and take the medications. Next myth. You can feel when your sugar is high. Many people say that I'm all right, my sugars are maybe high, but I don't have symptoms. So many people cannot feel when their blood sugar is high. The symptoms are very subjective and it varies accordingly. Some people develop for 300 and above, some people for 400, and some people even for 500, they come and sit in the clinic and say, I'm all right, I don't have symptoms. Of course, we ask one or two subtle symptoms they have, but so symptoms alone is not the deciding factor or criteria to start treatment. Blood sugar levels are the one we should decide the treatment. So regular testing is the only reliable way to monitor blood sugar levels, not the symptoms. Next myth. People with diabetes have to avoid fruits. In fact, people with diabetes can eat fruits in moderation. They should choose foods with low glycemic index. That is the rate in which the sugar rises after taking the fruit. That is called glycemic index. So if it is low glycemic index, you can take it. But however, keep that the amount of fruits should be kept in moderation. And watch portion size to avoid spikes in blood sugar. Even if the glycemic load is low or moderate, do not consume too much of fruits because ultimately they have sugars. And when compared with other forms of carbohydrate, fruits contain a complex carbohydrate with fiber. It takes time, so fruits need not be avoided unless sugars are very high, like 500 or something. Maybe temporarily you can avoid, but after that you can take. And however, fruit juice should be avoided. Generally, liquid form, either kanji or porridge, also can raise the sugar. Similarly, fruit juice also to be avoided. Some of the fruits are good for diabetics, like guava, apple, pomegranates, strawberry, or any berries. These are all good. Even other fruits you can take, but keep it in moderation. Next myth. Country sugar or jaggery or honey is good for diabetes. Of late, this is very much followed or liked by people. No, they want something alternate for the white sugar, so they start going for this country sugar. They also increase blood sugar, same like white sugar. Okay, they have some nutritive values, like country sugar may have some minerals. Okay, some iron if it is made in the iron vessel. So it may have some nutritive values, slightly better than white sugar, but anyway, it is also an added sugar. And the next thing would be this country sugar is initially people start with small quantity, but the sweet taste is little less. The off late they start consuming more and more and end up with sugars going up even than the white sugar. So better not to go for that, or if you go for it, keep it in moderation. Don't think that it is good and start taking and liberal quantity of any form of sugar. Still, people are not able to take beverages without sugar. Consider alternate low calorie options. That there are concerns. So plant based things like stevia and monk fruits are okay. There are not much side effects about this plant based artificial sweeteners. Next myth: millets are good for diabetes. It will alone control blood sugar. Like 1 decade ago, people were very fond of chapati, eat all the time chapati. Even now, many people are eating chapati, thinking that it will control. So millets are basically a complex carbohydrate, and it comes with a husk or fiber. So it is good only, but if you take millet alone, it is not correct. Okay? You need to take fiber in every meal and leans, proteins around 1/3, and healthy fat also. But do not avoid fat. Healthy fats like monosaturated and polyunsaturated fats, which are good only. So you can include millets in your plate, but portion control is important. As per ADA recommendation, in a 9-inch plate, your plate should have all these things: fiber, protein, carbohydrate, and small amount of healthy fat also. That is very important rather than what you are taking like a millet or chapati. So keep it in mind. Next myth: insulin is only needed in type 1 diabetes. Type 2 diabetes always can be managed with tablets. And keep pushing the doctor for prescribing more and more oral sugar tablets. The fact is, many people with type 2 diabetes may also need insulin, especially if oral medications and lifestyle changes are not enough with weights to control their blood sugar. So at one stage, the type 2 diabetes who had initially insulin resistance may develop insulin deficiency also. In that stage, do not deny insulin because it is needed. And second, if some complication happens, something like a serious foot infection or some organ infection like pyelonephritis, kidney infection, so during that complication, insulin is the best choice. So do not deny and force the doctors to step up the medication alone. Okay, so in a sick day or an emergency or complications, only insulin is the better choice. So do not deny or disagree for insulin. With once insulin taken, we cannot stop. It has to be taken lifelong. Not necessarily, okay? Sometimes your beta cell dysfunction may be temporary. So we can go back to tablets after starting insulin and stepping up it and bring it back to normal level. Again, sugar tablets will work better. So it depends on your body insulin secretion. If you have adequate insulin secretion and resistance is the main problem, still you can manage with sugar tablets. So don't have fear about continuing lifelong insulin always. You freely discuss with your doctor, he will explain and go accordingly. Myth, diabetes can be cured. In fact, diabetes is a lifelong chronic condition. It can be managed with healthy eating plan, physical activity, and medications. However, some of the early diabetes can be managed with diet, physical activity, and significant weight loss. Let's say 7% or 10% weight loss, put them into a state where they don't require medications. Okay? And it is better to be called remission but not cure because it may come back. Initially, they may follow with the intense lifestyle modification and weight loss that may not be possible all the time. So, who all can have remission if newly diagnosed diabetes within 2 years and HbA1c is not very high, like a 10, 11, it is not so, it may be less. So, in that cases, people are very enthusiastic to follow the strict diet, calorie restriction diet, and exercise activity. And those who can achieve weight loss, those who are young and educated, these are the people who can definitely try remission. Even late stage, no problem. You can try all these measures. It can bring down the number of tablets. So always be enthusiastic to achieve remission or partial remission. But client don't fall victim to the claim of diabetes cured by many. But artificial sweeteners are not safe for diabetes. So artificial sweeteners can be low calorie option and some people may experience digestive issues. So I don't recommend, but if patients are very much keen to taking the added sugars and sometimes we can recommend. And as our Dr. Bharani Idharan said about gut health, it may affect your gut health. Gut microbiome may be altered if you consume too much of artificial sweetness. But however, plant-based sweeteners like stevia and monk fruit are safe. A lot of studies are there. So type 2 diabetes is not like type 1 diabetes we can manage without medication and follow-up. So fact is both type 1 and type 2 can lead to serious complications if not managed properly. So including heart disease, kidney disease, nerve damage and foot ulcers and so on. So proper medication and follow-up is mandatory for type 2 diabetes. Proper knowledge and follow-up and regular following is very, very important. So keep your sugars under target, keep your blood pressure and cholesterol under your target, take care of your gut health, food health, and follow your advice. Let us make all diabetes people's life healthy. Thank you. I thank once again for Hindu giving me this opportunity. Thank you.
Thank you, Dr. Shanmugasundaram, for clearing all those doubts. I think the three presentations have really eaten into the program time. We don't have much time left. And there are lots and lots of questions. I'll pick up a few and then maybe the doctors could answer them directly once the program gets over. So since we started the diabetic foot, I'll just club a couple of questions, Dr. Kauvery, so that you could just quickly answer. One is very basic thing that people living with diabetes, should they go for pedicure? And people also who do not have diabetes, should they also wear diabetic footwear as a prevention? And what is foot numbness?
Fine. See, pedicure by a trained podiatrist is okay, but untrained people கிட்ட போய் pedicure பண்ணும்போது some sort of minor cut injuries, if it happens, then it may land up in infections or other problems. So if it's a trained podiatrist, we can do pedicure with them. And if the patient has insensate feet, that is numbness, they don't have the feeling, or if they have some arterial problems which may reduce the blood supply to the foot, it is always safe you contact a trained podiatrist or your doctor for doing all sort of the pedicure things. But I think for cosmetic purpose, pedicure தேவைப்படாது. For health purpose, pedicure may be needed. That we can do it by ourselves. We need not go somewhere and do it because they may
So,
not know the real problem of dealing with the diabetic foot. One thing. And the second thing is, diabetic footwear, is it necessary for everybody? No. If a patient has neuropathy, if the patient has reduced blood supply, those people only will have to wear this protective footwear called as diabetic footwear. Others and all, they can use the routine footwear, but usually we should make two or things necessary. One thing, it should be the size should be properly fit, and the material should be little comfortable. And the third one you asked was numbness. Yeah, numb foot, it is a sign of neuropathy. We have to find what is the problem for neuropathy and correct the underlying cause for neuropathy. You have to control the sugars, BP, cholesterol, everything. And there are medicines which can help in reducing this numbness also. Our doctor get a கேட்டு accordingly they can follow his advice.
Dr. Barinidharan, Saliha Zinab wants to know, how does Icodec act on the body? And this continuous glucose monitoring system. So, what kind of patients require this?
Yes. The first question I just answered about the Icodec. Icodec is a long-acting basal insulin. So actually, any insulin which is going to release a small, what is called the monomer, but that's the way it brings the sugars under control. This insulin, what is unique is actually it releases monomer very slowly, and the half-life is almost like 7 days. So that is the reason once we inject this insulin, it is going to be there in the body for 7 days. So that is a unique technology they used in this Icodec. This is how it acts, and we will see in the future how it brings the glycemic control. We are also waiting. And second thing about continuous glucose monitoring study, which patients I can recommend. There are a lot of things. So whoever the patients, they just want to study about how is the glycemic control with the medication and diet and exercise, they can just do it. And second, who have a brittle behavior of diabetes, especially patients who is taking insulin, too many insulins and tablets, they have a lot of changes in the glycemic control, like going for a low sugar, especially in the midnight, what we call as a nocturnal hypoglycemia. So that is very challenges for the patient and the physician. So those kind of patients, if we do a continuous glucose monitoring study, definitely it will help them to identify, and we can able to adjust the dosage. And also those who just want to care about their body in a preventive things like a pre-diabetes, those nowadays we are seeing those most of the patients who are going to the gym also, they are using the sensor. So that is also the thing where they keep the health watch, so they can check whether the sugar level is controlled with their diet and exercise. So they can also use it, and I can recommend that a continuous glucose monitoring study. Whoever they are just very much interested to know about the blood sugar level, they can just use it. Generally, for a diabetes patients, today we have this tool where we can give the precision diabetes care with these things, and we are able to improve what is called this time in range. That is what the range between 70 to 180. If you are keeping it almost more than 16 hours, we are doing good justice for the patients. So as a thing, as a physician, also happy that they are doing a good glycemic control for the patients. They improve the quality of life. So definitely anybody can use this continuous glucose monitoring study.
And what is insulin sensitivity?
Yes. So insulin sensitivity, to understand the insulin sensitivity, we should understand what is happening in our system. So generally when we eat food, it is converted to three things: carbohydrate, fats and proteins. So the carbohydrate, it releases the glucose. So once the blood glucose goes high, the pancreas is the organ which secretes the insulin. So the insulin, it takes blood glucose and enter into the, gives the glucose into the cell. So once it goes to the cell, that is called insulin receptors. So the insulin receptors only, it takes the glucose to the cell. So if the insulin is not working properly, that means actually the glucose is not entered into the cell because the receptor is not allowing. So the glucose will end up with a high blood glucose. So this term we call it as a insulin sensitivity. Actually, that sensitivity means the glucose should enter into the cell if it is working well. Like if a patient is physically active, they are able to take a good glycemic control achieved, then the glucose will enter into the cell properly. If there is a resistance, that means actually the blood glucose is not entering into the cell, the blood glucose goes high. This is called insulin resistance, and we call this as a type 2 diabetes. So this is a reason for getting diabetes. So the insulin sensitivity is very simple, that if it works, the glucose insulin works properly, the glucose will enter into the cell. The receptor will allow. This is called insulin sensitivity, and we can able to measure the insulin sensitivity with a small simple test called homeostasis assessment scale, by checking the fasting blood sugar level and also the insulin assay. So in a fasting stage, we can see the beta cell function. So this will help us to identify whether the patient is insulin is working properly or not, and also we can tell them the patient is insulin sensitivity, the sugars is under control. If the homeostasis assessment is high, they may have a chances of getting diabetes, the insulin resistance.
Okay, thank you. Dr. Shanmuga Sundaram, I think I'll direct all the diet-related questions towards you. There are too many based on your talk, and they range from, because you mentioned stevia and monk fruit, so how long and how often those can be used? Or, somebody saying that when I take medication and the sugar level comes down, so should I stop the medicine for some time? And there are very specific food related, whether I can take paneer, whether I can take chana, how much protein is adequate, then what are the high glycemic and what are the low glycemic food, what is good fat, good protein. There are tons of questions on food actually. So maybe if you could give a broad, thing of, yeah.
So artificial sweetness can be used. So instead of going for added sugar, you can consider plant-based artificial sweetener. There are no side effects. You can continue. But however, children, pregnancy definitely should be avoided. Other people can take. It comes as sugar-free natural in a green color bottle. That is the stevia. Monk fruit comes as liquid, and many people are not feeling comfortable, and it is costly also. One, regarding the artificial sweetness. Regarding the protein intake, if you are a vegetarian, yes, you can take paneer, mushroom, nuts, seeds. These are good source of proteins, and tofu, soya, and all. If you are a non-vegetarian, eggs, chicken, fish, these are lean meats, and mutton is a red meat. You can take in less or a moderation. This is regarding the protein intake. You can take 0.8 to 1 milligram per kg per day, and in Indian diet, protein intake is less only. So you have to consume protein in the daily plate. That is also important. Fiber, protein, healthy fat, this all required. This is regarding the diets. Any other question?
Yeah, there's an interesting question because all organs are related and the bodies, everything is interlinked and interconnected. So somebody is asking, if I have high uric acid, I can't eat high protein. I also have diabetes. I can't eat high carbs. So what food should I eat?
Yeah, basically, though we say uric acid is due to fat and fatty foods, high refined carbohydrate intake also a cause for uric acid or purine derivatives. So this you can take in moderation. You cannot avoid something like an allergy. You like that. You may not avoid completely. You take in moderation. You take lean protein still. You cannot avoid completely. Okay? Check uric acids. If levels are very high, like 9 and 10, you need tablets because it is not entirely due to taking the food alone. It is your metabolism is a problem. So sometimes you need medications and take in moderation as far as the uric acid is high. What is the next question? And
No, it was nothing specific, but it was saying like he has uric acid and he's a diabetic. So he can't take high carbs, high proteins, what he should eat.
complex carbohydrate. Whenever you go for carbohydrate in your plate, try to choose complex carbohydrate which comes with fiber in it. So it takes time to get digested. Sugars won't get spiked. Okay, gut health will be maintained. So you'll have a lot of benefits. So don't go for polished rice and wheat, maida, and other products. Go for complex carbohydrates that adapt to that, and your sugar level and all health will be okay.
So last 30 seconds each for three of you, just to wrap up your message on the eve of World Diabetes Day. If there's anything that we do not know about diabetes and which has to go out as a message, or you would like to reiterate some relevant message, 30 seconds each.
I'll
Dr.
take the
Kauvery.
first one. Please, the remaining 160 people who are listening to this talk, just don't think diabetes is just one day. World Diabetes Day தான் பார்க்குறோம் கேட்குறோம் அப்படியே மறந்து போயிடும். அடுத்தப்பறம் இன்னொன்று வந்திருக்கு அதுக்குள்ள. So the thing rotates around. நினைக்க வேண்டாம். Diabetes is going to stay there till your lifelong. So அதை பற்றின information, see whether it is right or not, and then take it and then follow it. எல்லா கிடைக்கிற நியூஸையும் போட்டு குழப்பிக்காதீங்க. One thing. Second thing is diabetes will cause problems head to foot. So awareness kattayama venum. Keep on listening to talks from trained people. Adu oru rendu. That's from my side.
Thank you. Dr. Bharani?
Yeah. So diabetes well-being is very important. It should be a physical well-being, it should be a mental well-being, and also a social well-being. So one thing which goes unnoticed is diabetes distress. So that we have to address every day. So we have to improve the quality of life of the people who are suffering with the diabetes. So it's not the diabetes which is going to kill. Control diabetes before it controls you.
Dr. Shanmugasundar.
Yes, I want to highlight about physical activity. Many people do walking but don't do muscle strengthening exercise. At least twice a week, you do some simple weight strengthening exercise at your home. And ultimately, consistency is the key. Either dieting or physical activity or medication. So it's a lifelong chronic disease. Be consistent in following this. Thank you.
Thank you so much. I really apologize for not taking more questions. There are too many, and maybe all of you could answer them directly. And so with that, we come to the end of today's webinar on diabetes management presented by the Hindu in collaboration with the Kauvery hospitals, which was held to mark the World Diabetes Day tomorrow. Thank you all for joining.
Thank you.